Now, maybe three-fourths of the way through your service, a funny thing happened. It was the most important event probably of our lifetimes, and that's the pandemic, the COVID virus. How did that affect you when you first learned about it? And then how did it affect the agency?
So, we started to hear about it. I mean, just I think all of us watching the news reports, and I've got a public health background. And to me, it was alarming because you've never seen anything like that. You've never seen China shut down cities, shut down schools, and, having conversations. I think we were concerned if it hit the nursing homes. And that was kind of, we said, look, if this hits the nursing homes, we're really in trouble. That was a Thursday. Saturday morning, all over the news, they're talking about the life care facility, all of these patients being evacuated. And honestly, I just went into high gear. I was still in Indiana that weekend and started to make arrangements. I wanted to make sure the CMS team was on the ground. This is a $1.3 trillion agency. So we had to make sure that operations were still going on, because if we stop, the whole healthcare system stops. We are the biggest payer. And the agency had to go virtual in a matter of a week. This day, we're all working in the office, and then the next day, we were virtual. So I was very lucky to have an incredibly dedicated team that worked around the clock. Not once did I ever hear a complaint of we're working too much, we're working too hard. These people were just doing whatever they can. And again, also they're managing their own lives. They're having to work at home. They're managing children. We started our COVID calls. And we'd have about 150 people from CMS on these calls. And we said, okay, we're going to do telehealth. And it wasn't, we're going to do telehealth and Medicare. It's like, we're going to do telehealth as an agency. So here's the vision. Here's what we want to do. Now, how do we all execute? Medicaid, what do you need to do to make sure we have telehealth so that children can get services and pregnant moms can get services? Medicare, what do you need to do? Medicare Advantage, what do you need to do? So it was bringing everybody together every day. Everybody got to hear what was going on. So maybe it wasn't your topic, but you could hear everything that was going on. So very intense. But I've been very proud of the way CMS responded during this time. And I think we've made it possible for the healthcare system to do their job.
If you reflect for a moment, where is the place that the OKRs made the biggest difference? Would it be COVID or some other gnarly part of the agency that you had to wrangle into
I think it,
submission?
I think it brought us together as one team. CMS has really functioned in silos. Medicare did its thing, Medicaid did its thing. And we came together as an agency. And, I heard a lot of people say when I first started the job, oh, it's just so big and there's all these different programs. But when we started to bring the team together, there was a greater understanding that the problems in Medicare, in Medicaid, in the exchanges were actually all the same. The rules may be different, but the problems were the same. And if we wanted to make these programs better, more sustainable over the long term, then we had to focus on problems that we're all facing. So if you think about price transparency, interoperability, those were some initiatives that fell across the entire agency. Anytime we started it, they all kind of came together. Interoperability, a great example, that actually fell across the exchanges, Medicare and Medicaid on interoperability. So I think that the greatest gift was alignment. And the other piece of it is the agency had a better understanding of what was going on. Satisfaction went up, employee satisfaction. I think people want to know what's going on. They want to be a part of something larger than what's the task right in front of them. And so I think it, brought, like I said, I think we are closer as an agency, and people were more satisfied because they had a better understanding of what the larger mission and goals were.